Hello guys, hope you're having a great time. Today's subject is a very interesting one. Testicular cancer. Testicular cancer is a relatively rare disease, accounting for just 1% of all male cancers. They particularly affect young men between the ages of 15 to 45. Despite their rarity, these cancers occupy an important place as they represent the leading cause of cancer-related mortality in young adults. The majority of these cancers are germ cell tumors, occurring mainly in men under the age of 40. These cancers are often discovered by chance. For example, when a nodule in the testicle is discovered, or when there is an abnormal increase in the volume of the testicle. There are two key tests which are essential for early diagnosis: testicular ultrasound, which can make us visualize the tumor, and tumor marker assays, which provide additional information on the nature and the extent of the disease. When it comes to treatment, the treatment of choice for localized forms is orchiectomy, which is a surgical procedure involving the removal of the affected testicle. In metastatic form, additional treatment such as adjuvant chemotherapy or radiotherapy is often required. These types of tumors are highly sensitive to radiation and chemotherapeutic agents, which means that the disease is in most cases curable when treatment is appropriate and administered promptly. There are several risk factors associated with the development of testicular cancer. These risk factors increase the likelihood of developing the disease, although their presence does not necessarily guarantee the onset of the cancer. First one is cryptorchidism and testicular ectopia. Cryptorchidism refers to the presence of a descent of one or both testicles into the scrotum, while testicular ectopia refers to the permanent location of the testicle outside the bursa or the scrotum. These anomalies considerably increase the risk of cancer, multiplying it by 20 even after surgical correction. Another risk factor, testicular atrophy, which is a reduction in testicular size, can result from various conditions such as orchiectitis, which is an inflammation of the testicular tissues, or from testicular torsion, or from dyskinesia, which is an abnormal testicular development. Another risk factor, the exposure to X-ray, is a well-known risk factor for many cancers, which can alter testicular cells and promote the development of malignant tumors. Finally, there are some genetic factors, like a family history of testicular cancer, which can also increase the risk. When it comes to diagnosis, there are so many circumstances of discovery. Testicular cancer can be discovered in different ways, often incidentally or when looking for apparently unrelated symptoms. A patient might present a progressive increase in the volume of the scrotum without any pain, or a sensation of heaviness or pulling in the testicle associated with a sudden increase in its volume. Also, the patient might present a palpable mass in the abdomen, which may result from lymphadenopathy or a testicular tumor that has metastasized. The development of breast tissue in men, or what we call gynecomastia, may be linked to a testicular tumor. Many cases of testicular cancers are discovered by the patient himself during self-palpation. Sometimes cancer can be discovered after a testicular trauma or an infertility workup. In some cases, testicular cancer is diagnosed at an advanced stage when metastases, particularly pulmonary metastases, are already present. The clinical examination is an equally important step in the diagnosis. It helps detect suggestive signs of the disease and guide further investigation. The examination of the testicles must be done comparatively. The examination of both testicles must be performed carefully, comparing them to detect any asymmetry. One of the characteristic signs of testicular cancer is an enlarged testicles, often penless, a hard or undulated testicle, or the presence of penless mass that distort its shapes is also an important factor. These masses can vary in size and must be distinguished from benign conditions. Another important element is negative transillumination. Unlike hydrocele, where light irradiations allows a glow to be seen, a tumorous testicles appears opaque during transillumination, confirming that it is a solid mass and not a fluid or a liquid. In cases of testicular cancer, the epididymis, which is normally located at the back of the testicle, is generally normal. After this, general examination to look for any other associated clinical signs, such as hepatomegaly, which is an increase in liver size which could indicate hepatic metastasis, or abdominal mass, often linked to retroperitoneal lymphadenopathy, which may indicate disease progression. Also, the general examination should look for any possible gynecomastia. The lymph nodes, particularly the supraclavicular nodes, must be palpated, as a testicular cancer is highly lymphophilic, meaning it spreads easily to the lymphatic system. Swallowing lymph nodes in these areas may indicate metastasis. Now let's jump into paraclinical examinations. Well, paraclinical examinations play an equally important role in confirming the diagnosis, assessing its stage, and guiding therapeutic management. First one is testicular ultrasound. It's the gold standard imaging exam for scrotal evaluation. It provides important information about the lesions and helps determine its location. Testicular cancer often appears as hypoechoic mass, or less dense than the surrounding tissue, with abnormal vascularization. The use of Doppler ultrasound detects chaotic vascularization. Ultrasound also helps evaluate whether the tumor has invaded local structures and assess the condition of the contralateral testicle. Tumor markers are used to confirm the diagnosis, assess prognosis, and monitor the disease progression. After that, we have sperm preservation, which is essential before any surgical intervention in systematic and testicular cancer management. Since treatment can affect fertility, this procedure allows patients to preserve their reproductive ability. The definitive diagnosis of testicular cancer is confirmed through the anatomopathological examination, which means analyzing the tissues removed during the surgical excision of the affected testicle. This examination helps determine the exact nature of the tumor. It is also important to note that the precontinuous biopsy is not performed to confirm testicular cancer due to the high risk of tumor cell dissemination. A biopsy could lead to the spread of cell cancer to other parts of the testicle or scrotum, complicating the treatment and prognosis. Diagnosing testicular cancer can be challenging, as several other conditions may present with similar symptoms, so it is essential to rule out other possible causes of a testicular mass or scrotal symptoms. First one, vaginal hydrocele, which is an accumulation of fluid within the tunica vaginalis surrounding the testicle. It may present as a pinless scrotal mass and is often mistaken for testicular cancer. However, hydrocele is typically translucent on trace elimination, unlike a tumor, which appears opaque as we said before. Secondly, a hematocele, which is an accumulation of blood and not fluid. It often occurs after scrotal trauma, surgery, or testicular torsion, or severe infection. It may present as a painful or painless scrotal mass. In this case, ultrasound is essential to differentiate it from other conditions. Next, we have chronic orchioepididymitis, which is a persistent or recurrent inflammation often caused by bacterial infections. Next, we have tuberculous epididymitis, which is a form of urogenital tuberculosis affecting the epididymis and sometimes the testicle. Next, we have syphilitic glioma, which is a chronic granulomatous lesion occurring in late-stage syphilis. It results from localized inflammations forming granulomas, which can progressively destroy surrounding tissue. Now let's talk about the treatment of testicular cancer. Surgery remains one of the main treatments for testicular cancer, and it's usually the first therapeutic step. Radical orchiectomy involves the complete removal of the affected testicle, sometimes with lymph node dissection if needed. This procedure is performed via an inguinal approach. It is crucial to perform this surgery as soon as possible without waiting for additional test results to minimize the risk of tumor dissemination. After surgery, the removed tissues is sent for more analysis to confirm the type of cancer and prognosis. Radiotherapy is mainly used to treat lymph nodes. It is used to eliminate remaining cancer cells after surgery and prevent recurrence. The goal is to minimize long-term side effects while ensuring effective cancer control. Chemotherapy is another key treatment, especially for advanced or metastatic testicular cancer. It is given after surgery to eliminate residual cancer cells. Chemotherapy is highly effective with high cure rates and involves the administration of cytotoxic drugs that target and destroy cancer cells. After initial treatment, lifelong follow-up is essential to detect recurrence or complications early. For that, regular clinical exams and paraclinical tests are required. This allows early intervention if a new tumor or metastasis appears. I hope these informations were helpful to you, and don't forget to like this video and subscribe to our channel. Thank you so much for watching until the end, and I'll see you in another course. Goodbye.